Hi, my name is Tiffany, and this is for my communications class. Today I will be interviewing Megan King. Go ahead and introduce yourself.
Hello, my name is Megan King. I'm the charge RN here at Kaiser for primary care.
So we're going to go ahead and just interview her with a couple of questions. So what is your current background in healthcare?
My current background is I've been a medical assistant for 10 years. While I was doing MA school, I was doing my prerequisites for RN. I've been an RN for about 5 years now. My background as a medical assistant was in primary care. My background for RN was med surg, a little bit of ER, and then now primary care with injection room.
So now working in primary care, what are the differences that you see through med surg and family practice?
Here I'm more critically thinking as a nurse. I have more autonomy for myself and my patients, versus at the hospital I have more doctor's orders hands-on, where I critically think, but ultimately I run everything by the doctors. Here a lot of times I have the free will to practice and then get the doctors included after. So there's a lot of differences. I feel like I critically think here more.
So overall, how many years do you have being a nurse?
5 being an RN, 10 being a medical assistant, but 15 years altogether.
Okay. And what would you say is the biggest challenge that nurses face in healthcare today?
The constant change. My biggest thing that I have had to face is that I'm always the youngest nurse, medical assistant, but my knowledge is what kind of gives me my advantage. So I feel like I have to prove myself with the older nurses and really validate myself and trust my skills. I feel like my age is really what kind of hinders me sometimes, but then once I figure that out and they can see that I can hold it, I feel like that's my biggest challenge.
And then since you've been in healthcare, or at least a nurse for 5 years, what is advice that you would give to anyone wanting to become a nurse?
I say, for one, like I always tell you, don't do the LPN, just go straight to the RN. That's going to be additional schooling. Just go for it. Learn your scope that you're wanting at that time. Definitely, as a new RN, get some hospital experience in you. Clinic work as a new RN is going to be very hard because you're not going to know what to really do as far as the critically thinking. The skills is completely different, but then you get pulled into stuff where you're like, oh my gosh, I haven't done this in forever, that kind of thing. So that would be my biggest advice. And then also just keep on going. Just started school because I want to go higher, so that's where just keep on going higher, and then really know what you want to do. If it doesn't work for you, then just leave. Know your worth.
Okay. And then, so when you come into work, what impact do you hope to make to patients in your clinic?
I feel like I want to make more of an impact with the staff, more sometimes with the patients, because then that can affect the patients. If you have a good morale with the staff, I feel like that's going to present to the patients, where it's like patients feed off of that. So I feel like my biggest impact when I come in is to ensure that patients are getting taken care of, making sure that, hey, this patient's been waiting in the waiting room for a long time. Let me see what they're waiting for. We've done that several times. So just the patient experience, but then I feel like the staff is really more important with that too.
Okay. All right. Well, thank you for doing this interview today.
You're welcome.